Welcome to Mind Your Migraine. This episode, we will try to break some of the misconception and truth about this condition. And I'm very excited to introduce to you my patient, Miss Julia, who I met in 2015, visiting me for a headache condition that turned out to be a migraine. So, Julia, welcome to the show. Can you please run us through your particular story as it had unfolded over the times until we met each other?
Thank you very much. My pleasure to be here today. So I'm probably not a typical patient for migraine, but if there is such a thing as a typical patient, I just had usual headaches for the majority of my life until late 30s, where I had some really specific pain locations. So I had headaches that were always in the same area of the head. I wasn't really familiar with the condition of migraine. My father had headaches, quite severe headaches, but it wasn't really classified or talked about as a migraine. Now, in hindsight, I think very much that was the case. So I didn't really pay attention to it too much. And at some point, the usual over-the-counter medication stopped working. It didn't really help anymore. And it just continued to appear, hardly disappear. And it was a condition that wasn't really something that I wanted to accept anymore. I didn't see a doctor for quite some time because I was just under the impression that if you have a migraine, that's just what it is. There is not much you can do. My surrounding, that's what I knew about it. Yeah, those that were suffering from migraines, if they're lucky, they had a medication that could occasionally help, but there wasn't anything reliable. So at that point, I thought, let me find that out. And I came to see you.
Mm-hmm. Yeah. So when we saw each other, I diagnosed you with migraine, and you carry this diagnosis since then. And we have been quite successful beating it as well. So I would be interested to hear, now that you know it's a migraine, what kind of misconceptions did you have before you knew it was a migraine?
Mm-hmm. Well, one of my first misconceptions was, well, it can't be a migraine because I'm end 30s. I would have had that earlier. I always thought that a migraine comes up when you're, in your 20s. Yeah, otherwise, it will never develop. Is that the case? Is that how the usual course of that, of that condition is?
So I would say it's a bit of both, myth and truth. Because, yes, usually migraines, they do start in the teenagerhood, even sometimes in childhood, but they sometimes disguise themselves as something that you don't really realize. For example, children, they may have belly pain, and it actually is a migraine. And teenagers, they may have pain that they disregard. It may be related to the period or something, and they just disregard it. And in retrospect, it was already the beginning of a migraine. Mm-hmm. There's some things that are very important about migraine that I would like to divulge on for our listeners. Migraine is a condition. It's not a disease, and it is a trait that you have and you are being born with. It is not genetic in a way, like other genetic diseases that are inherited, but you have a disposition for it. And so not every brain can respond in a migrainous way, but the migrainous way is 4 chapters. And one chapter is, you always have this never comes out of the blue. You feel something is happening. You may recall this. And then your behavior changed a little bit. You get a little antsy, or you get a little bit of, maybe some smells, you feel them more intense or obnoxious, or, something like this. A lot of behavioral abnormalities are seen in a period that I call premonition. So mm-hmm. the build up from this moment up to the migraine. Then about 30% of the people, I don't remember if you were one of them, they have what we call an aura. And an aura is a visual disturbance. It's either light flashes in your visual field, or it is actually clouding of the visual field. Sometimes people are blind in one visual field or even in one eye. And then afterwards, this pounding migraine starts. And the very important characteristic that many people have, if not most, is that they get a little nauseated. They hate the light. They just want to be in a dark room, no sounds, sleep it off. Somehow they manage to sleep it off. And then they wake up the next morning and they have a brain fog. It's like, like a hangover headache. I mean, this is basically what a typically migraine is.
Mm-hmm. And what do you say to people that say it's just a headache? You don't need to take that overly seriously. Just sleep it out.
Well, what I do tell them is it is in the eye of the beholder. The migraine is a condition. It's not a disease. So if you feel that the quality of your life is deteriorating, then you might want to do something for it. If you say it's something that I live with, then that's okay. It's absolutely up to the patient. Usually when patients, have migraines, they have them once in a blue moon for a while, or maybe not at all like you. And then all of a sudden something triggers it to become more frequent. And so the frequency, and this is why we distinguish between chronic and episodic. So the episodic one is still relatively infrequent, but the chronic one is very, very frequent and usually requires some kind of treatment.
Yeah. Going back to one of the misconceptions that kept me away from actually seeing a specialist about this condition is that my belief was that there isn't anything that really truly helps. There isn't a medication that can cure it or can treat the immediate pain. Is that right?
That's a myth, because there is treatment now. But again, it is not a disease, so you don't have to cure it. All you have to do is you have to make it more palatable. So
more bearable.
Exactly. So as I said before, there's these different kinds of migraines, and they are based on the frequency of them and based on the days that you actually have the headaches, either the migraine headaches or these fog headaches afterwards. Some people, they have what we call a status migrainosus. They are in headaches for weeks and it turns out to be migraines. So depending on the severity and the frequency, you choose the treatment. And there's basically 3 different treatments. When you have this migraine that happens very frequently, you want to prevent it. Yeah. You don't want to deal with each of these migraines every other day with a treatment. No, you want to take something that takes care of it or at least ameliorates the pain. This is what we call prevention treatment. And this is what I gave you in 2015, if I remember correctly. So this is the hope of these treatments, depending on what you give the patients, is that they don't get the migraines anymore, or if they do get them, they are much less severe. If there are people who only have them during the period, or maybe twice a month, or at certain situations when they're under stress, then what I do is I tell them, I give you a medicine that you take and it's going to abort this whole thing. So when you take it very early, when you feel it coming in this premonition phase, you start taking this medicine and then it won't progress to these very, very disabling, pounding headaches in the second phase. So this is what we call an abortive treatment. And sometimes people don't have the medicine with them and then they just progress into this disease process. And then they can only take painkillers, any kind of painkillers. But this is what we do. We do three treatments: the prevention, the abortion, and then contain the pain.
Could caffeine trigger migraine?
Myth. Caffeine actually is given as a medicine to ameliorate the pain in migraines. It's often part of the so-called NSAID medications. They are combined with caffeine and it helps.
Yeah, my personal experience, it helps me a lot. Yeah, if I don't have a coffee in the morning, it's very similar to the migraine pain.
Yes.
Going back to the medication that you mentioned, that is a possibility to use. How about pregnant women? Can they take these kind of medications, or which one can they take, if not all of them?
Well, the pregnancy is an interesting question, because pregnancy is a treatment per se. Women don't get women with severe migraines. They stop having migraines during the pregnancy, and as soon as they deliver, it happens again. So it is probably the level of the estrogen that is higher, that is preventive, and then the change after delivery makes them sufferers from really bad migraines after.
And diets and supplements can cure migraines. Is that a myth, or is it true?
I think that's a myth. What we do recommend is magnesium. Magnesium in different kinds of forms is helpful for some people, but usually it doesn't matter. In terms of the diet, as I mentioned before, it is more like, the amount that you eat or the time that you eat it. It's not really the quality of the food. It is the quantity and frequency.
Okay.
Thank you, Julia. On behalf of all of the migraine sufferers in the community, thank you very much for your story. I'm Dr. Derk Krieger, and this is the end of the program.